There is a looming threat hanging over the heads of everybody in this country, and not to mention everybody in Pennsylvania. And that is the threat that the Supreme Court could rule in as early as first or second week, I guess, in November, that the Affordable Care Act is unconstitutional. And if they do that, that act is going to go away. And if that act goes away, I want you to just think of what that means for every Pennsylvanian. Everybody, every family, every business, everyone. This is going to mean hardship. I don't think we recognize what's been in place now for 10 years. When it goes away, if it goes away, we're going to go back to the way things were. Now, how were they back then? Well, if we lose the Affordable Care Act, clearly this is going to be devastating for the individuals who for the last 10 years have actually seen an increase in their options when it comes to insurance. I expanded Medicaid. It's one of the first things I did when I got to Harrisburg, and that put almost 750,000 Pennsylvanians into free health care. And we added the exchange, the other insurance options that were the benefits of the Affordable Care Act. Another, 960,000 Pennsylvanians got health insurance through that. That's 1.5 million Pennsylvanians. We have 13 million Pennsylvanians who had health care who didn't have it before. They're going to lose that. And that's before you factor in all the things that happened with the COVID pandemic. There are going to be a lot of pre-existing conditions out there. Well, remember before the Affordable Care Act, pre-existing conditions? Well, you were out of luck. You didn't get insurance. So how many people are going to have, actually including, I guess, our president, pre-existing conditions, and you're not going to be able to get insurance. You're not going to be guaranteed insurance. You are under the Affordable Care Act. That goes away. And by the way, the president's executive order that claims to put, all that says is that it's our idea that pre-existing conditions be protected. There's no mandate. There is nothing that says anybody has to do anything when it comes to pre-existing conditions. They're going to go away. Again, what's life going to be like if we go back to the way it was? Substance use disorder sufferers. What have we been talking about for the last how many years? The opioid epidemic. If you have a substance use disorder problem, you need treatment. You don't need to be stigmatized. You need treatment. And expanded Medicaid allowed tens of thousands of Pennsylvanians to get treatment for substance use disorder. That's not available by law. It's not available. It wasn't available by law before the Affordable Care Act. It is available under Medicaid. And so tens of thousands of people who are now being treated for substance use disorder, that goes away. How about gig workers? All those folks who are working for Uber and all those folks in the gig economy that's getting bigger and bigger and bigger, that goes away. The health insurance that they don't have through their employer, that they only have because of the Affordable Care Act, that goes away. So individuals are obviously going to suffer, and I think we all know that. But I think it's important to note that all of us suffer from that. Businesses, individuals, and families. Let's start with insurance premiums. I was in business until, 6 years ago. I've been in politics for almost 6 years. Before that, I was in business. That's what I did for most of my adult life. Every year, we talked about what our insurance premiums were going to be. We talked amongst ourselves to say, how much do you think what we're paying in our premium is actually a cross-subsidy? How much of what we're paying is going to pay for all those folks who go to the hospital, the emergency room, that was our national health system before, who go to the emergency room and can't pay, either because they have a high deductible plan or because they don't have any insurance at all. They go to the emergency room, they have no money, they can't pay, the hospital has to treat them in the emergency room, the most expensive part of the hospital. What does the hospital do? They have to break even. So they spread that around, that cost of not having someone pay for their service, they spread that around to all the people who are paying. All of us who are suckers who were paying for insurance. So the estimate was that we were paying somewhere between 5 and 20% additional in our premium simply because we were paying for folks to get a free ride. That's what happened before the Affordable Care Act. If you were a business, you were being hurt. How about job lock? One day I was walking through one of our facilities out in West York. This guy comes screaming up to me in a forklift, and he jumps down from his forklift and he says, "I hate our insurance program." And I looked at it and I said, "Wait a minute, you're not paying anything for it." Back then it was free. It was one of those Cadillac plans. You could go anywhere. It was your husband works there, right? That's the way it was. So anyway, I said, "I'm game. What don't you like about the health insurance program? Maybe I'm missing something." He started laughing. He said, "No, it's a great plan." He said, "That's the problem." I said, "What do you mean?" He said, "Well, I'm 49 years old and I don't want to keep doing what I'm doing. You know, I want to do something different." I said, "Well, we have free education. You can change your career track, take a course. You have to take courses, change your career track." He said, "Nah," he says, "it's not just that." He said, "I don't want to be in this industry." I said, "Well, okay, that's a problem. I don't know what you want me to do about that, but just for my own edification, what industry would you like to be in?" He said, "I'd like to make furniture." I said, "Well, why don't you do that? Why don't you go and make furniture? That'd be great. Create jobs, and you might fail, you might succeed, but you know, you could end up making some really nice pieces of furniture and create jobs." He said, "No," he said, I can't because I'm afraid that I'll lose my health insurance." And he said, "I can't be without health insurance for maybe 2 or 3 years, even if I succeed, that I might be." He said, "I have a family, I have kids, I have a spouse." He said, "And we might have a health emergency in that 2 or 3 year period, and I'm going to be out of luck, so I got to keep this job." So I said, "All right, I get it." So I was walking away and I was thinking, wait a minute. So he's doing something he really doesn't want to do. I have an employee who's really not fully in that job, and all of us are out of that furniture. What's the sense of that? And I was talking to someone later that evening who's an expert on healthcare. He said, "Yeah, it's called job lock. And there are millions and millions of the Americans who are suffering from job lock." Now, if you just take a very small fraction of those millions and millions of people in the United States who are suffering from job lock and who would go off and maybe create a new company, create new jobs, new products and services, you know, we are cheating ourselves out of that. That's what we did before the Affordable Care Act. Now with the Affordable Care Act, we're on the way to actually creating the opportunity for that guy to say, "I no longer have to be trapped in a job I don't want to do." And that's the nice thing about this. The other thing is that before the Affordable Care Act, again, the emergency room was our place of treatment. And it's an expensive place. And it was no accident that before the Affordable Care Act, and we're getting better, but we're still the most expensive developed nation in the world when it comes to health care. The most expensive. And our outcomes are below average. I think we're 7% higher than the OECD average, and our outcomes are less. The point is, we can't afford to go back. All of us, none of us. Obviously the ones who are directly affected, but none of us can afford to go back to that bad age before we had at least an approach to universal health care. Now, could we do better than the Affordable Care Act? Does it need to be bolstered, as Carol said? Of course. There's nobody who says we can't do better. Even Obama, President Obama, understands we can do better than we have. But what we can't do is scrap it. What we can't do is go back to the way it was and just sort of say, yeah, well, that's the way it used to be, and we'll go back to that. It's not sustainable. So let's ask our Senator, Pat Toomey, to do what he said was right back in 2016, when there was 11 months between the time to choose a new person for the Supreme Court, new justice, and the election. And he said, "I don't think it's right to vote ahead of the election, 11 months ahead of the election. Let the American people decide who they want for their president, and then let that president do the nominations." Okay. So Senator Toomey said that in 2016. Let Senator Toomey follow through on his own idea about what is legitimate and what is the right thing to do for the people of this country, especially right now when the stakes are so high. So let's make sure that we do everything we can to hold on to the Affordable Care Act.